The meeting will begin in 10 seconds.
Good afternoon. So I'd like to call this meeting to order of the Pitt County DSS Board today, Tuesday, August the 13th, 2019. And we will open the meeting by observing a moment of silence. Thank you. Okay. Thank you. And public comment, we have anybody? We don't have anybody, nobody signed up for public comment today. So I would ask people to adopt today's agenda if there's no revisions.
So moved. Second.
Thank you, Ms. Mary. And then also we have copies of last month's minutes. If we could take a look at those and make sure there's no changes or anything to. And if not, if I could have a motion to approve?
So moved. Second.
Okay, thank you. Okay. So, items for report today. We're going to move right into Ms. Jan's report on our strategic plan in terms of our update.
You all have received a copy of the strategic plan. As you remember, when we talked about doing this, that we would highlight the things that have been added since the last report. I am certainly not going to cover all of those things in this discussion, but we've gotten a lot done, and we're in the midst of a lot of other things. So we're excited to share this with you. Our child support unit, for example, collected 101.75% of the targeted amount, so they exceeded their goal this year.
Bravo.
Isn't that great? So, and it's a significant sum of money, and Michelle says every time she does this, that means she's got to increase it again next year. So, but that is going to support our children in Pitt County, and so it certainly meets the goals that we're talking about. Early education, or our child daycare program, we continue to struggle with getting children off the waiting list. The funds have not been released, obviously, and the funds are not keeping track or keeping up with the needs of the children here and the parents and children here in Pitt County who are working. We have, as you can see, had a little bit of increase this year in the number being served, but it is a minimal increase. So still not fully up to where we were in September of 2018, but did want to report on that. As far as the improved child safety and permanence, the project that Gwen and the agency have been working on now for a while, we had 42 children discussed in our permanency roundtables. And of those 42 children, that's 42 this year, of those 42, 10 have already achieved permanency through reunification, guardianship, kinship, custody, or adoption. And one of those children had been in care 12 years.
Wow.
So we are really proud of how that is working. Our foster parent training program, another very important service or need of ours, has been streamlined from 10 weeks to 5 weeks. It's still the same 30 hours of training, but we've been able to condense how we're doing this. Our legal department has begun meeting quarterly with our child welfare staff to identify the barriers to permanency for foster care for any case that has been in for longer than 15 months. And so that also is helping us move children to permanence much quicker. It's been a really, really good thing for us. In the last year, we've had over 60 children leave care and be reunified or go into adoption. So that has been really, really good. Moving on to another area, talking about partnerships, grants, and other resources that can be used. We have had, with our child abuse prevention project, we've had 12 of our staff plus another 12 or so from the partnership, Smart Start Partnership, and some staff from the school system. So a total of about 30 staff, agents countywide, have been trained in the protective factors through Prevent Child Abuse, but 12 of those have been DSS staff. So we are moving that project forward with our goal of, again, reducing the likelihood that children are going to be abused. The agency has applied for and did receive approval for right at $100,000 from AmeriCorps to help us with our social work students coming into the agency to do their internships. It will provide a small stipend for them. Hopefully, our hope is that these folks will want to stay and work for Pitt DSS and will reduce our turnover. We've also applied for some other grants that we have not been notified for that are about $3.7 million. So again, some of the highlights there. We have, for our support for our vulnerable adults, couple of the highlights there, we are continuing obviously to see a large number of reports for abuse and neglect of our disabled adults. But what you can see here is that we're increasing our in-home services support for folks so that they're not perhaps having to go into a nursing facility. 98 of our 106 community alternative slots have been filled, and you can see from this graph that the number of adults receiving in-home services continues to steadily increase. When you see the drop down, it might mean that somebody's been out of place, and so we haven't been able to process. But that is moving very well. We had the APS walk this spring to recognize APS and the needs of our elderly as it relates to that, just to call attention to that. So when you look at our opportunities for self-sufficiency, some of the highlights there, our employment and training unit helped 22 folks secure employment, and most of those had a starting wage of $10 or higher. So again, has been a wonderful service. We had 94 people enrolled in our employment and training program on June 30. So that has been consistently a positive activity for us. If you move to our communications area, we have implemented our food and nutrition services grant that we got. It was $316,000. We're almost ready to go live with that. A training has been going on. This is going to allow folks to register themselves in at the Human Services Center. It's going to allow them ultimately to scan their own information so that it can be readily uploaded. It's going to allow for more electronic records activities, signatures, that kind of thing. It's also going to help with some notifications to clients. So we are just about there, and we're hoping that in the next month or so we'll be able to maybe have a meeting in the other building and let y'all see how that's going. But it's coming really doing well. We used our adoption promotion money that we got. We used that to purchase 2 electronic billboard advertisements about adoptions. We're doing other things with that, but that's some of what we've done to encourage adoptions. We had the Child Abuse Prevention Festival, which some of y'all attended, which clearly was about partnerships. So we think that was an example of one of the things that we have done this past month or this past year. And the Child Abuse Prevention Walk took place in April, again, just to highlight, in addition to the Child Abuse Festival, that need and that service. When you look at staff development, I can say that all of our administrative management and supervisory vacancies in the past period of this 6 months have been promoted from within. So we are developing our staff and encouraging promotions. Our management team are participating in the Leadership Academy, and that will conclude in March. 96% of our child welfare social workers in the last year have completed 24 hours of training to help keep them up to date. And then our 2 human services planners completed in a program evaluation training at UNC Chapel Hill School of Government. So another example of some of the things we're doing to help develop our staff. So then looking at agency organization, and some of these could go in various places, but we put them here. We've completely restructured the foster care licensing unit. We were able to do that because we got the 4th supervisor, so we started that process and have now completed it. So that we have a foster care licensing section, we have an adoption section, 2 separate units as opposed to trying to do them together, plus 2 foster care units that do nothing but work with the foster children themselves. So we have established a career ladder committee to try and look at how we can also address staff development. The committee right now has chosen to focus on 3 areas: leadership development, employee appreciation, and employee recognition. The employee appreciation piece, they're planning a family fun day, September 28th. Which is a Saturday, have hot dogs and hamburgers for all and some games, and we hope staff are going to reach out and participate in that. We are trying to do some things with employee recognition. We're a large agency, and one of the things that we've been talking about since we started our leadership training and since we started this career activity is that we have all these new staff coming in. We're in 2 buildings, we don't know each other. And so we started this week with a picture of our brand new staff member that was sent out across the entire agency so that folks could welcome him to the agency. And we will continue to do that with new staff. And there's some other things we're going to try and do. The leadership development team is trying to figure out how we can develop future supervisors. What kinds of trainings can we be doing? How can we encourage them to be prepared if they want to be promoted? No guarantee that anyone who participates in that would be promoted, but it does help them prepare. So those are some of the things that are going on with that, but it's an active committee. It is totally composed of a group of staff and some supervisors so that we're trying to get all the perspectives, and it's both buildings. Our other thing we're doing, and I'm real proud of this, we have reduced our average recruitment time from the point a job is posted. Now, you know, we freeze jobs. So from the point a job is posted and released for advertising till we actually make the job offer has gone from 95 days to 45 days.
Congratulations.
So we have significantly reduced that.
That's good.
So, and that doesn't say from time to time we have one that will last a while because we're having trouble recruiting, but generally now we're moving on a steady stream. So those are some of the highlights. Y'all have had a chance to look at this. If you've got other questions, I just didn't want to spend time going through every single thing.
I do have a couple questions, Jan.
Okay.
So remind me when we talked about daycare. I know that we have priorities in terms of children that are prioritized. Can you remind us what those are?
Right. They are employed, well, first and foremost, people who are in child protective services situations or foster care are number 1 on the list. And then we move to folks who are working, and teen parents are in there. Now, right now, Michelle, did I miss anybody in the top 4? Okay. There are some homelessness, I think, comes in there. Also, they've added homelessness at the state level to be a top priority. The unfortunate issue, however, is that the state has said we cannot add anybody off the waiting list because there's not enough money to fund all of the children that we currently are serving We can bring on folks who are in foster care or in CPS to prevent placement. Those are to be kept at a very low level. And so we're kind of in a catch-22 statewide. I think the state spent 102% of their monies this past year, so they had to shift some things around in order to cover all of our spending, but they did cover all ours. But they are telling everybody, do not bring anybody off the waiting list. The other issue it's causing for us, however, is that when you're in work first, you are required to look for work. There are some activities you're required to participate in, and you have a time clock. And if you can't participate in those activities because you don't have childcare, and we can't put you in childcare because we can't move people off those roles, it is impacting the client's ability to meet the requirements. The state is calling the employment side of the house is calling counties in error in audit if they're not moving children off the waiting list. So that's a different division, and the child daycare folks are saying we can't move children. So we're kind of in a catch-22 right now.
Sounds like a conflict.
It is a real
Does,
conflict.
doesn't it, Mary?
Yeah, the other issue that we need to think about too is if someone moves from Wake County and was getting childcare to Pitt County, we are required to cover that person whether we have money or not. So again, complications. But we have a set amount of money.
Where are you supposed to get the money from? That's what I was.
Well,
that didn't come out of my
Yeah.
head.
No, there are a couple of things. One, of course, is that we certainly hope that the state can find money to help us if we get in a bind. But we are supposed to manage our money and not overspend. I think we came out, helped me, 102% this year. It's what we spent. And like I say, the state covered our overspending. It was not a huge amount. Otherwise, we would have come to the county to say, how can we cover our overspending? And, you know, we would look for unspent monies within our own budget to try and cover
But
that.
thank God you didn't have to come to the county.
Right.
Not
So,
yet.
so,
So is this an issue across the state?
it's an issue across the state.
Jan, I have a question.
Yes, ma'am.
The Leadership Academy, do you contract with the company to do that? With who is implementing that for your
We
your
have,
team?
a company that several counties have used. It's one individual. He's written books, et cetera. And he has a curriculum that is being used across the nation in various county governments and state governments around leadership in human services, because it's very human services focused. He comes out of the human services background. And so he has the full curriculum, the slides, the workbooks, the books for the folks to read. He has the whole thing. He can come and do it for us for a fee, or he's available by phone for consult, and we can do it ourselves. So we had him come for the kickoff meeting, and then each of us has taken a month, and we have been doing the training. So, and it's laid out so that you have specific issues, specific discussions, and then over the 3 weeks between the meetings, you have specific workbook activities to do in addition to the readings. So I think most of us have found it to be very helpful. It's not necessarily stuff we didn't know. It brings things to the forefront, and helps you think it through. And it does he does ask some good questions that really causes us to talk about values and those kinds of things. So
Does he leave any of his resources?
he leaves all the resources.
We pay him to
We
come
pay-
in over here?
Well, no, he gives us, we pay for all this curriculum,
Okay,
and then we use it,
okay.
okay?
That's what I'm talking about.
Yeah.
So, just one other question, Dan. In reading this, there were two opportunities I saw that in the report you spoke about a foster parent association that's been
Yes.
formed.
Yes,
Is that, and they meet, I think you said they meet monthly?
yes.
Would that be something that a board member could attend? Would that be appropriate to do that?
I would think there wouldn't be a problem. I can certainly ask, but I wouldn't think so. We've had various folks attend.
Yeah, I was just looking at opportunities for board
Right.
involvement. And at the very end there too, you in terms of a DSS agency-wide training on Medicaid transformation, you spoke about that too.
Right, yes, we did that for all the staff, to try and get them, understanding what was getting ready to happen. And then the various units have, especially in Medicaid, have been talking a lot more about what's going on.
And I would
So
just,
it's really gonna,
It's really gonna happen. They keep, they're moving forward. I mean, they clearly said that to us at the Institute. They are moving forward.
as I read this, I was just looking at opportunities, appropriate opportunities that the board may, not that would always be available, but there would be
Right.
opportunities that we could interface with some of this. And that's what I was looking
Now,
at.
October 4th, we are scheduling a day at the Cooperative Extension Auditorium to have all of the prepaid health plans to come in and spend the day meeting with folks who would need to try to figure out what group they
Selection.
want to sign up with. There's still a lot of providers that have not signed up yet, and so I think
who's invited to that?
this would be the clients themselves, but certainly it would be open to, I'm gonna invite my staff to go over and talk to them. Not that they're supposed to be advising clients, but at least
They can at
education.
least hear.
They can hear the
And
different
information
things.
is important.
Right, the different things that the different groups are offering. And certainly, I mean, board members could come by if they wanted to, but I'll have more detail on that closer to time.
Okay, thank you. Good questions. Okay,
In the new staff and all the things you're doing about the staff and the newness and all that, I'd like to know if you get any input from internal promotions and how you say, oh, this new person is here, we look forward, stop by and say, I'd like to know how it does with morale. Because you know, I haven't brought it up lately, but I am keen on morale because I think we get the best service from people when their morale is high.
Right. Now, right now, we're pushing work in Medicaid. They have 2,700 product delivery cases to do this month. They're down several staff, and the state carried forward some cases. NC Fast suddenly found 3 months of cases that they brought forward as past due cases, and we're trying to research those. So it's not a happy time.
It's a corporate.
Right
I
this
tell you
second.
that NC staff fast is.
So we're probably doing some overtime, and we may be rolling some cases forward.
okay.
Okay.
Okay, next item on the agenda is child support background check policy. And Michelle, you gonna talk to us about that, Michelle?
I wanted to give you kind of an overview of some information regarding the background check that the Child Support Office will be required to do as a means of being in compliance with the Internal Revenue Service. The Internal Revenue Service Publication 1075 requires agencies to conduct federal and local background checks for all employees, contractors, and subcontractors, if authorized, who have access to federal tax information. In order to comply, Child Support Services has developed an electronic criminal record check system that will allow all counties to submit their employees for local and federal background checks. Each county has already designated 2 or more individuals for their Human Resources Department to enter the information into the system. So we have 1 primary and 1 backup person here at the local level for that role.
And Susan May is one of those people.
Right.
Congratulations, Susan.
Policy has been developed to guide counties through the background check process. Counties can either adopt this policy or create their own policy, as long as it complies with federal and state compliance standards. We would be requesting to implement the state's policy. If a county chooses to develop their own policy, it must include at a minimum All employees with access to federal tax information are subject to local and federal background checks, Federal Bureau of Investigation fingerprinting and citizenship requirement checks. All necessary steps have been taken before an employee is allowed access to federal tax information. The suitability background check is favorable, and current employees must submit to a background check upon implementation of the policy and every 10 years thereafter. When the background check process is started for an employee, the IRS 1075 background investigation certification form must be completed and sent to the state office. This form does not need to be signed at the initial submission. The form is signed when the background check is completed. A webinar training for each county's designated human resource representative to use the Child Support Services criminal record check system will be conducted a week prior to the county's rollout. A webinar invitation will be sent to each designee via email, and Pitt County's scheduled rollout date is January the 17th. So shortly prior to that, Susan would be contacted along with our backup person regarding the webinar for the procedural process for the completion of this. We have already on the local level made contact with our sheriff's department so that they can anticipate around this time frame that we will be sending staff over for the fingerprint process to begin. So as we indicated, we would be recommending that the recommended state's policy be adopted. And if you have any questions regarding any of this, I'll answer them at this time.
I do.
Okay.
When you say checks, background check, fingerprinting, all that sounds like cha-ching, cha-ching, cha-ching. Who pays for it?
Well, the federal background check is reimbursable. So 33% would be at a county expense. The remaining would be able to be reimbursed. Some sheriff's departments choose not to charge a fee for the fingerprinting process. I think it is $30 for us, but they're anticipating that the combined costs would not exceed, I think it's $150 per person. But again, that is subject to federal reimbursement. The federal background check, all the information aside from the fingerprinting process will be invoiced by the state for the state to get the reimbursement process from that, and then what part is owed by the county will be deducted from the drawdown on the 1571.
Get that?
No.
Basically, it's gonna cost us money.
That's, it sounds like other than the 33% for the county.
And we had budgeted for that because we knew it was coming.
And has the sheriff department know that she's gonna have to do some?
Yeah, we've met with the sheriff and with the former person who is now downstairs in EOC, but we had met with Sheriff Danson and Randy Gentry about that, and you know, they're on board and ready for us.
Records and ID, security.
Mm-hmm.
That's going to be secured.
Mm-hmm.
Well, anybody can hack anything. I thought about the city. So I just hope we don't have that problem. And
That's one of the reasons why they stress that it is only 2 people with each county that has access to that information. And there are only 3 people at the state level that will be on the receiving end of that information that comes back from those checks.
okay.
And
All right,
at the
yeah.
state level, that is for across the entire state.
Susan is one of our
Checkers.
Right.
checkers.
Right. And of course, if we get a hit, we have got to go through the steps as outlined.
Right.
We ain't gonna get no biggie.
No, we're not.
We won't
So
get
Michelle, is this a major change for you in terms of how you do business now?
Okay. So we were child support was already subject to particular guidelines, strict guidelines in order to enjoy the rights of being able to receive the federal tax information. But the addition of the background check is new. The implementation of this policy, the process of implementing it was not taken lightly. This was over a 3-year period in terms of developing and ensuring that we had the right language for the policy. I am part of the Policy Modification and Liaison Committee with the state. So this was a part of what we were charged with developing. It also required legislative approval. So from that aspect, we were involved with the AG's office in terms of trying to make sure that we had the appropriate language, as well as the state's communication with the official, with the IRS, to make sure that we were satisfying all of their terms in order to be able to move forward and continue to receive this information.
Now, Pitt
So,
County's always had a background check, but never this extensive.
That's what I'm talking about.
Thank you.
Well, this is the new world we live in.
any other questions?
Thank you for that work. So we need a
We need a
motion.
motion to say you want to adopt what the state has done, and
I move
my
that-
recommendation is do that just because they've done all the research, and I would hesitate to even try to.
I move that we accept the policy and use the policy that the state has set down.
Second.
All those in favor?
Aye.
Aye.
Thank you. Thank you, Michelle. Okay, next on the agenda is this year's SSI Institute, the Social Services Institute, which was at the end of July through the first of, I guess it was July 30th through the 1st. Jan's asked me to say a few words about this. Mary, we missed you. So,
I miss going.
yeah,
This is the
yeah,
first
'cause-
year I've missed, but I needed the break.
yeah. So it was I think I can say it's always good to get away and hear new things. It was nice to be able to be with the staff in terms of, we had dinner that night, kind of midterm in the event. Our regional social services board representative Cora Wichard was there, and she was able to spend time with us too, and she was manning a table for the association in terms of things, which was nice. Had the opportunity to hear from Amy Wall, and she did board training for board members, and I thought that was
Excellent.
it was very excellent training. Had the opportunity to ask questions, and a lot of things came up that were very thoughtful in terms of things for everybody. There were displays. Had the opportunity to hear about different things, and one of the things came up. There's an insurance product that's out there protecting social services agencies in terms of when we're talking about Medicaid, and the opportunity that, I guess the new standard that social services are responsible for any errors in terms of things. So somebody has stepped forward to create an insurance product.
Well, that's new. Isn't that new?
It has been in the works now, and a few counties started buying this last year. We have seen the package. The recommendation for the county our size was $75,000 to $85,000. It is potentially not reimbursable by the state or federal government, and the deductible is $10,000 per incident is what we have been told. We've looked at it. We've thought about it. We keep waiting to get better offers.
Cause that sounds like a little bit of money.
Well, it is a little bit of money, and there's an argument still going on whether we can report it for administrative reimbursement. If you can report it for administrative reimbursement, then that 85,000 gets cut basically in half. But it would be if you had lots of small claims,
10,000.
$5,000 claims, you'd be paying them all anyway. So at this point, we're sort of biting the bullet and saying, let's wait and see. We're in audit right now, and there are more and more opportunities for us to be audited. We have the federal audits that are going on right now, that they're pulling cases from us at least one a month. We have the county single audit going on. The state has hired a group of folks who are going in and auditing 200 cases per county. We are not scheduled to be in that audit for another couple of years, and the state auditor has decided she herself is going to have her crew audit 700 cases across the state, in addition to what the single audit folks are doing. So there is plenty of opportunity to mess up, and it's a hard job. So, but that's a lot of money to put out.
That
But it
destroys
would
a
take,
budget.
it would take one case, however, to make it worthwhile.
So have any counties moved forward with it, Gene?
Richmond County was the first one to,
Yes, sir.
actually, to get involved, and in Rockingham.
Okay.
They were the first county to move forward, because actually they were who discovered it, because it's a health and DSS agency that's joined together, and this comes out of the health world. They started as malpractice people. And so he's been the one to do the initial work down there, because of his interest from the health side. It's improved a whole lot. They're now covering more than just Medicaid. They'll take care of everything from 4E mistakes to, other kind of program errors that cost money. So it's moving along, but we're still having the fight with whether it is reimbursable or not. And so now we're at the federal level having that argument, because the state is saying they do not believe it is reimbursable. So there are about 4 counties that I've talked to recently. I cannot tell you who they are off the top of my head, who have indicated they have purchased. And most of them are pretty small counties. The dollar amount's not
Makes
much, and
sense,
it wouldn't
yeah.
take much at all for them to have a major issue. There are other counties exploring it on the director listserv on a regular basis. You see conversation about this. So the numbers are growing. And our risk manager here at Pitt County, initially when we talked to him back when this language passed in the legislature, said, he investigated with our insurance company and they said there was nothing they could do. Apparently now that this is floating, our insurance company that Pitt County has said there might be another policy they might could do as an addendum. So we'll talk further about it. And we already know we have one error in this year's audit.
That was my next question.
Yeah, we do have one. They're not through with this yet, but in the first week with the single audit, we have one error where we failed to, we did a recertification on an individual who was deceased. And if you're gonna make a mistake, that seems like one to make. However, there apparently was a claim filed after they were deceased. So we're trying to do the research to argue it, because it could have been a claim that had occurred prior to them dying,
And then they filed
and it, it just didn't get filed.
came in late.
Yeah. So we're trying to argue that one, but right now that's about a $9 error.
That's a
but-
relief.
But
Not worth that big policy.
the issue is, it's not the error that the auditor finds, because they're gonna go back and look at the entire period of ineligibility. The auditor's only looking at 1 month. So lots of counties have said those $5 or $10 audits have turned out to be $10,000 in claims, because when you look at the whole 12 months, there were multiple claims during that period. So,
Have their counties experienced, I mean, significant claims?
That in error there
error.
have been, gee, I haven't heard the last figure. The second year we were in this, there were over $400,000 in claims. I'm not sure what the most recent year is.
Oh, my Lord, another 100,000, that'll be $500,000.
But again, spread over 20 or so counties. But, yeah. So it's a big issue, and that's certainly something all of us need to pay attention to and look at, and it's good that they were there to talk to folks.
Yeah, it was. Catherine, you have anything you want to add to the Institute? Any?
I just enjoyed being with everyone there and getting to meet people from across the state. That was great. Coral was wonderful to talk to. She was delightful, and the Amy, again, from the School of Government was very, and seemed very comfortable and confident with her information when people would ask questions. So that gave me a lot of faith in her if she's training board members for counties.
Would you say that in attending that, it was well worth it, and you certainly continue to, as we get new board members, encourage them to go? Because at one point, I think this board was slack on going.
Absolutely.
I did say slack.
No, I think it was very worthwhile. I really did.
I've always found it that way. That has been a very strong learning point for me when I came on this board.
Well, I think you pick up something new each year when you go, even if you've been to the same workshop. So.
Okay, moving along, good discussion, into the director's report, and we're going to start out with Medicaid transformation, which we heard a lot about at the SSI Institute.
Y'all like to do this for me.
We did.
Y'all like to do this for me. Yeah,
Oh, Lord.
yeah, I really don't have a whole lot to add. Information is going out. We are understanding that the state is moving forward until they're told not to move forward. The big issue, however, is that the budget that has not passed yet has all the money in it to make Medicaid transformation work. So there is another bill that's been introduced that has that in it. It's a budget bill fix that will allow them to take this piece and go ahead and get it passed, but that hadn't passed yet either, so, but they're moving forward. What I can tell you too is that the PHPs, the prepaid health plans, are going around, and they were here in Pitt County not too long ago meeting with staff and other counties, giving out information about what they're planning to do and how they're planning to work. And I didn't want to kill all the trees, but I'll be happy to pass this around and let y'all take a look at what the different groups are doing. Because they're all trying to have, open lines of communication, just like with your regular insurance company. I mean, they're trying to do all those things. Have the nurse helplines, have some resources for folks. I will start it this way, and then we can work it back this way. They're going to have some things for folks to help them, maybe if they're trying to lose weight or quit smoking or do those kinds of things. I understand that there were about 28,000 doctors that had signed up as of the end of July thereabouts, but the numbers are increasing. However, I was talking with a doctor today about a child we've got, and she was talking about the Medicaid card, and I said, well, with Medicaid transformation, we won't be helping get the Medicaid card anymore. It'd be the provider. And she said, well, a lot of us aren't signing up. So I don't know what that's going to ultimately mean. So not a whole lot new to report there. There's absolutely nothing new to report on the MOU. I will try to have you some quarterly figures on how we're doing shortly on the 13 that we're being held accountable for. I think we're doing pretty well from what I can gather from what I've seen so far. Michael Beckett's has resigned. For those of you who know Michael, he will be going to Fairfax, Virginia, and he's been sort of the MOU person of record. So he will be the director in Fairfax, Virginia shortly. So unless you've got questions about transformation or the MOU that you wanna ask, I might can answer some of them or not. Okay, the Medicaid application processing report, we are at 96% for the MAD and 94% for other Medicaid on our timeliness. And you can see that we're processing within 29 and 57 days. So just to put in perspective, 29 days, we have 45 days to process a case, so we're processing within 29 days. We have 90 days to process a case for MAD, and we're processing within 57 days. So
Sound like
our staff
super-
are doing an excellent job.
Wonder Woman and Supergirl.
They're doing an excellent job. So, unless you got a question, and again, we are 12 months, we're good, so we're not in any danger of corrective action there. As far as our agency personnel, we have, at the point this was done, 20 vacant positions. We actually have no frozen positions as of this morning, so.
Thank you, county management.
Yeah, we work on that. We are working around advertising, interviewing. You can see we brought a lot of folks in since the last meeting. 5 of the 20 here are our new positions. We have 1 more of the new positions that we got from, from the budget that'll be recruited this week, so that'll make 6 of those. We're still waiting on some issues around job descriptions for the remaining 2. A lot of this movement is internal churn. Somebody retires and somebody moves into that position, which creates then another vacancy, so there's some of that going on. So, we are, doing pretty well, I think, on that, so.
I still like to commend you on internal promotion. That helps morale. I really feel positive when
Okay.
I see officers do that.
Okay, and I can say that when you see one that says they were demoted, it may mean that the person wanted to move into a different role because the role they were in may or may not have been the right fit. And so if we can do that, and there's a job they can do, then in order to keep them with the agency, we certainly want to honor their,
Stay employed.
yeah, these are not negative demotions when you see that. These are those that they wanted. So,
Okay, thank you, Jan. So we're near the end of the agenda here, and we're into board member comments. Commissioner Perkins?
I will, as you know, I've been on vacation the month of July, and happy to say that it really was worth needed. I just didn't know how tired I was, and I was really fatigued. So as soon as I get up with Senator Don Davis and Representative Candy Smith, I would like to invite the board to the September 21st breakfast that we are planning for our area. You all know I have some very strong emotions about Medicare expansion, and Jan is going to be she's committed. You still committed, aren't you?
yeah, I won't go there. Yeah.
Jan is committed to share with my district the changes that's coming down that will affect families. You all know I pulled this census stuff on my data for some time ago, and my district will very heavily be impacted by this Medicaid transformation. So I thought to pull some leadership in the district together and prepare them for being able to help families. I'm very strong about families to cope and deliver so that maybe you wouldn't have a tremendously hard time, and there can be some moral healing as well as the social healing of families. And that's going to be September the 21st at Newin Chapel Life Center. Whatever it is on Package Craft Road. You can look from one end of Package Craft Road.
Package craft.
Paper craft.
Paper.
Yeah, to the other end. So anywhere on Package Craft is the only big building on Paper Craft. I think I'm naming it wrong.
Hold on. I've
It's
got it.
in Bethel, North Carolina.
Package
Huh?
craft.
Yeah, package craft, yeah.
Package craft.
Yeah.
Okay, I was right the first time. Thank you. And that's where it will be, and I certainly want to make sure that you all get an
Please do.
invitation. Senator Don Davis and Representative Candy Smith will be co-sponsoring and has agreed to do that as I host it with Jan Elliott for the district. And we're having it way out because that helps with the transportation for the people in Bethel. It's just good to have people go to Bethel every now and then because it's so far out. So please look for that and attend if you can. And various departments and the sheriff and things will be there, because if it's not fully understood, we can have some real problems, I think. And I hope we don't, but it's best to take proaction rather than reaction. So I just wanted you to know that, and thank you so much for bearing with me while I'm on vacation.
Catherine, any comment?
Not today.
Okay. Just like to say that as I was reviewing the strategic plan update and was looking at that, and Jan had highlighted a number of just really significant things and things that have occurred over the last, I guess, the last quarter, or 6 months?
6 months.
6 months, and I just want to thank Jan and the staff. I mean, really nice, thoughtful events that occurred, and it was just kind of, I don't know, I remembered the events, but it was a nice recall in terms of hearing about it again. So I just want to thank you for that. Yep. So if there's no other comments, I guess we're gonna
Move to a close, adjourn, or leave.
So is that a motion?
It's so moved.
Second, we're done. Thank you.
Now, I'm on vacation